Thanks, Janet. Well, as we age, it's normal to feel changes in our bodies, but oftentimes these changes are symptoms of more serious and life-threatening diseases. And if you're one of the millions of cigarette smokers in the U.S. or know someone who is, you may be interested to learn more about chronic obstructive pulmonary disease, or COPD. To give us a little more insight into this condition, we're joined today by Dr. Richard Casaburi, Associate Chief for Research in the Division of Respiratory Medicine at UCLA. So, Dr. Casaburi, what exactly is COPD and why are patients often unaware they have it?
Well, COPD is chronic obstructive pulmonary disease. A lot of people know it as chronic bronchitis or emphysema. It's a major healthcare problem. About 24 million people in the United States have it. It's the third leading cause of death. It's probably the second leading cause of disability in the United States. So it's a major impact disease. You know, how can people not know they have it? Its major symptom is shortness of breath and cough and sputum production. And a lot of people feel that those are natural functions of getting older, that naturally happens. But in fact, it doesn't. These are symptoms of COPD people need to be aware of.
Now, doctor, who's most at risk for COPD?
Well, it's cigarette smokers. About 80 to 90% of people with COPD are smoking now or have history of smoking. And stopping smoking is the first major way of dealing with COPD. Other causes are less common, including other inhalations, secondhand smoke, but really it's mostly cigarette smoking that causes it.
Now, Dr. Casaburi, what are some of the symptoms that patients should be looking for to determine if they have COPD?
Again, cough, sputum production, bringing up phlegm on a regular basis, and not being able to keep up with your friends because you get too short of breath to go on. Those are the things that you need to look for.
So, doctor, how do patients with COPD manage the disease?
Well, the steps are as follows. First of all, stop smoking. Second of all, get diagnosed. You go to your doctor. There's a very simple test, blowing into a machine that will diagnose COPD and how severe it is, and then get treated. We don't have any cures, unfortunately, but we do have treatments that make breathing easier. These are mostly bronchodilators. These are drugs that relax the airways. They're taken by inhalation. They relax the airways so you can breathe easier. I might mention there's a new therapy just coming online. It's just recently been approved by the FDA called Tudorza Press Air. It's made by the Forest Laboratories. I've been working with them on this drug. And it's a bronchodilator made to be taken on a regular basis twice a day. And again, it makes breathing easier.
And finally, doctor, where can viewers go to get more info on COPD?
Well, you know, first of all, your doctor is a good source. Second, there's a lot of good sources on the internet. There's a website that's going to open up very soon called morematterswithcopd.com. Morematterswithcopd.com. It's a website full of good information, good links to other sites. And the nice thing is that there's going to be a $5 donation for everybody who signs up on the website to the COPD Foundation, which is a very good nonprofit group that helps all COPD patients.
Well, this is certainly a huge issue for millions of Americans. Thank you so much for joining us today to discuss it.
You're very welcome. You have a good day.